being here. Do say good afternoon, because I want to greet you good afternoon, so it's customary to respond.
Good morning.
This is a very important day and milestone for the city of New Orleans. I'm actually excited because it demonstrates progress. It demonstrates that the public, our residents, have been not only paying attention, they've been doing what we've been asking them to do for now over 2 months now, to the point where we were able to move into phase 1, which was safest at home. We started that, as you know, May the 16th. And now we are at a place where we will be moving into phase 2 coming this Saturday, June the 13th. Last Friday, the state of Louisiana went forward with phase 2 of reopening, which was great. But based on the science and the data, specifically in Orleans Parish, we just had to wait just a little bit longer. But wait no more, it's coming. So we are, again, on a different timeline, simply because the city of New Orleans was disproportionately impacted by COVID-19. It's very clear, the data demonstrated that. We were an epicenter in the state of Louisiana and the United States of America. We were that hot spot. We have consistently flattened our curve at a rate of 96% and growing. And we continue to demonstrate that we are. The cases are declining significantly, of course, as even relates to our people that we have lost. Fewer deaths that we are seeing. But as it relates to milestones, let's stick there. Testing continues to happen very aggressively. We have now tested upward of 13.3% of our population here in the city, being a leader, not just in the state, but again, US of A and even in the world as relates to our testing and the ability to sustain that. Our healthcare capacity, and thank you to our healthcare professionals that have been on the line every single day fighting back this virus, and the capacity continues to be where it needs to be. We have capacity in our hospitals. Also, as it relates to, and I just mentioned, a steady decline in new cases. So even as we go deeper and being intentional, whether that is touching our Latinx or Hispanic community, whether that is making sure that we're hitting our nursing homes repeatedly with testing, whether that is going into our homeless shelters, again, we are seeing a steady decline in cases and fewer positive cases. That allows us to do a couple things. One, identify, do the contact tracing, isolate, and quarantine. That will keep us away from community spread. That is our goal. The virus is very much alive and around us. It will be until a vaccine comes to the fruition. So we have to continue to be vigilant, get tested. Testing is always available, and no symptoms are needed for that at all. We're averaging upward of 700 tests per day. And again, that positive rate, that percentage is right at 2.2%. Now let's get into phase 2. We wouldn't be here, again, without the cooperation from our residents, and we continue to thank you for that. Phase 2 will be easing some restrictions, and I'm going to hit it. Dr. Vecno is going to give you more information on the data, and then we will drill down a little bit further as needed. So, sector-specific guidelines will be in place to ensure safe operations. High-risk residents, like our seniors, like those living with underlying conditions, we continue to say to you, you need to stay at home, take care, stay away. Everyone should wear face coverings. This is mandated by the city of New Orleans. And we also know throughout this second phase that our governor, John Bell Edwards, has also increased that focus on face coverings in public. It is important. It matters. Everyone, again, while performing non-outdoor recreation public activities, essential. all businesses will be required to register with the state fire marshal. Again, just as we did through phase 1, as businesses are coming into line for phase 2, they need to register with the state fire marshal. You do that by visiting opensafelyla.gov. Thank you, Butch Browning, our fire marshal, for just being so consistent with those guidelines. We appreciate that. The following guidelines are in line with the state's phase 2 guidelines. I want to hit those real quick. Operations opening at 50% capacity with social distancing. So, phase 1, we were at 25%. Now, come Saturday, those businesses will be able to move to 50% capacity, again, following guidelines, social distancing, and the like. Contact tracing elements, all in place. Restaurant and bars with food, gyms, fitness centers, barber, hair salons, spas, tattoo establishments, retail and malls, aquariums, zoos, museums. It includes the Children's Museum. That was a big one. Community centers, conference and meeting rooms. Now, this is a different team. We're opening our bars at 25% capacity with social distancing. This is something new that comes online again this Saturday. In phase 1, it was bars that sold food, that had a food permit. Phase 2, no food permit required. However, social distancing requirements absolutely required. This also goes for outdoor pools, the ability to open with a 25% capacity. Operations that will remain closed and or prohibited. Indoor live entertainment, festivals and fairs, amusement parks, arcades, in addition to music and concert halls. These are aligned with the state guidance and guidelines and mandates. City Hall will ease into physical restrictions and open to the public at a limited capacity. This information, again, will be made available to the public after this press conference, but with limited, again, accessibility. Individual departments and agencies will continue their guidelines. This information, again, is available. As in phase 1, there are some guidelines, though, that will continue to differ from the state of Louisiana, but showing us a little bit more love based on, again, the progress we've made. This includes our houses of worship. So, in phase 1, our houses of worship had that limited capacity of 25% and or 100, whichever was the lesser number. In phase 2, we are allowing, the city of New Orleans, we're allowing houses of worship to move from 25% to 50% capacity, but with a cap at 250 people. So again, a little more restrictive than the state, but it's very necessary in the city of New Orleans. Gaming establishments. This is also something that we were more restrictive in phase 1, but we're moving to allow our gaming establishments to open this Saturday, June the 13th. This means Harris Casino. It also means the fairgrounds, but they're opening at 25% capacity. As we do well, 21 days pass. If everything is great, we'll continue to lessen restrictions. But Harris Casino, video poker, fairgrounds will be open. Gatherings such as weddings, funerals, or other events will be limited to 100 people. This is still growth, still limited, but it's growth, it's progress. But the crowds of 100, you will need to have a crowd control officer per 50 people. So if it's 100, then you would need 2 crowd control officers. This is mandated again by the state fire marshal. This will be for indoor and outdoor event venues. Special events permits will be required for some locations. More restrictive gathering sizes now, and again, at a steady, in the future, will increase as we do better. This reduces the likelihood of having to snap back, right? I've always said, and we've collectively said, as we make progress, we want to continue to make progress, being steady and consistent in progress that we're making. And because of the public, because of you, we're on the right track. We want to stay on that path. We're hopeful again that these guidelines will allow us to move forward in that spirit, but being very cautious about the existing conditions that we know are a fact. We can't hide, we cannot run, but we can face our challenges head on and move with balance and consistency. So with that, I'm going to turn it over now to Dr. Jennifer Avegno, who has been just the leader in this effort, and I never miss the opportunity to thank Dr. Jennifer Avegno for her talents, for her commitment and dedication to the city of New Orleans, and at the end of the day, most importantly, to public health. Dr. Avegno.
Thank you, Madam Mayor, for the kind words, but this really is a team effort. Not only our team here at the Health Department, which has been fantastic, but the team at the city. And New Orleans, we are all one team. And the fact that we have gotten so far is because of that. I want to give really just sort of the science underpinning to the way we are moving into phase 2, so that everyone understands why we are being a little restrictive. We've talked about it many, many times before, but I really do want people to have a good and robust understanding of why, although in many ways we're aligned with the state, we do want to take that slow and steady approach. So again, just our current situation, and the mayor said it, we, from our peak in new cases, which was about the beginning of April, the number of cases we're seeing a day is over 95% decrease. That is tremendous. While we might have been a leader in the country in the rate of how the cases went up, we're probably also a leader in the way that our cases have gone down and have stayed down. What you're seeing in many other places is that there'll be a peak and a decline, and then there'll be these sort of little waves of cases going up and down, bouncing up and down. That is not what we're seeing here. We are still at over 7,000 New Orleanians who have tested positive for COVID. 512 deaths is a big number, no matter how you slice it. The mayor mentioned we've tested over 13% of our population in New Orleans. Only Rhode Island and Iceland have tested a greater population. We are truly leading the world, and again, our mobile testing continues to expand, and we want everyone to come and get tested. The R-naught that I've talked about before, remember that's how transmissible the virus is. So if the R-naught is 1, that means that if I have the virus, I can transmit it to one person. When that number is below 1, as ours is on every estimate that we have, that means that we are suppressing the virus. It doesn't mean the virus is gone, but it means the likelihood that any one person infected can transmit it to multiple people is low. That is where that number needs to stay throughout this, and we're doing a great job. I've talked about this before, right, but I want to continue to reiterate it. We continue to meet all the criteria for moving forward from one phase to another. Not everywhere can say that, so we're proud that we do. COVID is not gone. It has not gone anywhere. It is still here and will continue to be here for quite some time. What we do know about it is that the majority of cases, the majority of outbreaks come from high-risk events. These super spreader events that we've talked about, where the common themes are large groups of people not wearing masks, not social distancing, touching each other a great deal, or singing, or doing activities like that. So I just want to reiterate that. Next slide. How we assess risk. When we are looking at the science and the data and figuring out how to move forward safely and steadily, we look at activities, businesses, sectors by how risky they are. And really the risk of COVID is only, can be measured in a few things. Number one, the more time that you are in a close contact with someone or a group of people, your risk increases. The closer you are, we know that the droplets that contain COVID can be transmitted 6, sometimes 8 feet. If you're singing or breathing really loudly or yelling, we think it might be more, right? So the closer you are to someone, the higher your risk of being infected. The more people you're with, if one of them is positive, that raises the risk that others will be. And then what we do know is that it seems that indoor activities are higher risk than being outside. So I just want everybody to understand the framework for how we look at every single sector when we're moving forward. So the mayor went over most of this. Both in the state and New Orleans, and hopefully everywhere around the country, there are some fundamental truths that are going to continue throughout all of the phases until we get a vaccine. And that is wearing masks or face covering. Evidence is coming out every day that strongly supports how wearing face coverings saves lives and reduces transmission. So we feel very, very confident. We did not know that a few months ago. There was a lot of uncertainty, but what we're seeing is that it's really working. Washing hands, cleaning surfaces, maintaining good sanitation and hygiene, not touching your face, etc. Physical distance is also a key in preventing the spread, as we've talked about. And then again, who we want to protect most are those most vulnerable to getting a serious complication from COVID, being hospitalized and dying. That is our elderly, that is our individuals with high risk medical conditions. For them, it is still not safe to go out in the world like they're used to. So I'm just gonna reiterate what the mayor said. In most things, our phase 2 looks very much like the state's phase 2. We know the state has great advisors, public health. We have developed our phase 2 based on local, state, and national public health experts, and so we feel very confident that this is a step in the right direction. Again, if you are at 25% with distancing and all the other requirements, you are moving up a level to 50%, and that's everything that you see here. Some things are new. As you know, the interiors of malls were not open in our phase 1, but now we have a lot of confidence that a retail store, whether inside a mall or a standalone, is safe with distancing and again the 50% limits. We are also following the state with opening bars at 25%. Again, the nature of a bar is more suggestive of activities that people will be congregating, gathering in groups, and in a little bit more close contact. So we need our bars to maintain physical distancing between different groups. If you're there with your household group and you're having drinks at a table at a bar, we really need you not to go up and mingle with the other tables, right? Because we do know that there have been numerous events that started in bars, right? So we can mitigate this, we can do it, we just have to be a little bit more careful, and that's why we in the state are being a little bit more cautious with that 25% reopening. Both for us and the state, there are things that are still not allowed. And again, you can see the theme. These are events that have large groups that are very difficult to mitigate. Think of a festival and how hard it would be to keep everybody 6 feet apart wearing a mask. It's just really difficult, and it's a high risk event. So these are all closed for now. There are every business has its own specific restrictions on top of this. And so again, as the mayor said, everyone needs to go to the state fire marshal and review those guidelines. So what is different? And I want to talk about what is different, and then I want to talk about why it is different. We want to make a distinction between activities that you do with a large number of people that can be controlled or mitigated, and those that tend to be less easy to control. So when we're talking about movie theaters or houses of worship, and we put these together in the last phase, they both have start times and end times. So you can come into your church, you can go to your seats with your family members, you are going to be sitting there, not really interacting, not getting up, not dancing, not doing anything else, and then you leave at a certain time. So really the highest risk would be that coming and going and that tendency to congregate in entrances and exits. But the majority of the time, you are are sitting with your household size group. So for them, we are raising them to 50% capacity like the state, but we still know that they do present some elevated risk. And that's why they are capped at 250, which is the state's gathering size. As the mayor said, what we hope to do is take that next 3 weeks, as we know we need those 3 weeks of evaluation, look and see if we are still progressing, if every milestone is being hit and we have not had any concerning outbreaks around this, then we may take off that 250 cap or we may increase it somehow. Events with open gatherings. So the gathering size limit for the state is 250 with 1 crowd control officer per 50 people. Remember, it was 10, so we're going from 10 to 250. That is a large jump. The difference is, if you have an event and there are 250 people there, it's very difficult to be able to trace or track or remember all 250 people. Those of you who've had a large wedding can probably agree with this. We think that it is prudent to start off with a smaller gathering size, because again, these are gatherings that we are going to try to mitigate, but just by the nature of what they are, don't really lend themselves to mitigation as much. 100 people is a little bit more manageable. Again, having that person per 50 to try and make sure people are not congregating and getting too close to each other for too long of a period of time will help. But we think that it is important to start slow, and then again, in 3 weeks, be able to reevaluate and potentially raise that cap. And again, I think the mayor went over gaming establishments. There's sort of a hybrid in between the potential to gather large spaces and a lot of surfaces. So we think that starting at 25% is the right choice. So again, why are things different? We were hit hard and fast. We know how bad this can get. We cannot go back to those days. We need to stay slow and steady where we are. Again, if we start slow and we still see good results, that gives us a lot more confidence to move to the next phase. What you're seeing in other areas of the state now is that there's some conflicting data, right? There's some parts of the state that are seeing a rise. And so then what do? How do you know which way to go back? Do you keep going on? So we think that, as we progress, we want to really understand what impact that it's making. And again, as I mentioned, the lower numbers will help us as contact tracing is getting off the ground. I just want to do a comparison. This is obviously not every state. I could put every state in here, but I picked some states and cities that I think have good comparisons to New Orleans. So when you look around the U.S., the gathering size limits of all of these states and cities, except for Michigan, are far smaller than ours. So we really are going a little bit farther than even Mississippi, Georgia, Florida, Nevada, Las Vegas, right, San Francisco. I feel that we can do this because, again, we have sustained such a remarkable decrease and plateau. It's not even a plateau, it's more like a valley for weeks and weeks and weeks. So I feel that we can be a little less restrictive than the rest of the country, but I just want to give context because I know there's been a lot of concern, why aren't we opening up? Why aren't we doing it like X state or X city? Well, they're actually more restrictive than I think a lot of people realize. So what's next? What's now? As the mayor said, we will enter into phase 2 at 6:01 a.m. Mayor on a Saturday morning. Remember, we are being consistent with the 3 weeks of time period for monitoring data because we know that's the virus's time. And then that puts us at July 3rd. If that 3 weeks of data continues as the past 3 weeks has, then we very well may loosen restrictions and either fully catch up to the state or at least get closer with some of those things. What we have to do, though, is increase our testing focus on the areas of most concern. So that's our nursing homes and shelters, which, as the mayor mentioned, we are well on our way to do it. We truly want to test every essential worker and hospitality worker that is either back at work or returning back at work. We have heard your concerns. We understand. Yes, we understand you have a lot of confusion, worry about going back to work. We do not want that to happen. And so we are asking businesses who are hospitality essential worker businesses, please get in touch with us. We will make it as easy as possible for your employees to get tested, and repeatedly if they need to. We're also testing our NORD camp staff. This we think is gonna give us a kind of a good idea of what schools might look like, what happens to a group of children and a staff in an enclosed environment. That might really help us know what to do for schools. And then whenever we see hotspots, and we are looking at maps and data every day to figure out where we need to go next, we're going there. So that's all I have.
That's good.
Yes, ma'am.
So thank you, Dr. Avegno, and next we'll hear from the man who needs no introduction, and that'll be our director, Colin Arnold, and then we'll follow up with questions and answers for time.
Thank you, Madam Clerk. Afternoon, everybody. Just real quickly, we've come a long way, and we still have a long way to go, and this is a further move towards getting back to the community that we know and love. But I would just say that we need to be as cautious and deliberate as possible in this, because said it before, there's really two ways you can go, it's forwards or backwards, and I don't think any of this will go backwards. The Emergency Operations Center continues to be activated, supporting the COVID-19 projects and operations that are going on in the city. That's assisting Dr. Avegno and the health department with the mobile testing sites, our logistics operation. We've given out over 200,000 of Hanes masks to the general public. We appreciate all of our city departments, the council, and our nonprofits for assisting us with that, because we've got more to give out, and we're going to continue to do that. And then, other than that, our operation up in the Emergency Operations Center is a lot about just situational awareness and information, and that's what we're doing. We had to pivot, and it brings me to another point. We had to pivot this weekend for Tropical Storm Cristobal. Probably the best outcome we could have had. We had some coastal flooding outside of levee protection, but other than that, we fared very well. I think the Weather Service was pretty spot on with the forecast, which allowed us to get ready, allowed the public to get ready, and we did. We saw it. Very appreciative of the public. I saw people gathering supplies on Friday and Saturday like we asked them to. I saw people calling in about storm drains, addressing storm drains and issues around their own homes. It's exactly what we asked you to do, and then we asked you to stay inside on Sunday and Monday, and you did. So, great work. We're already at D, and it's the first week of June. This is going to be a long hurricane season. Please just stay with us, stay weather aware, pay attention. You can follow us at NOLA Ready. You can go to ready.nola.gov. You can text your zip code to 888-777 and just stay informed. So thank you.
Thank you, Colin. All right, we've given you a lot of information, I know, but at this time, we can go right into Q&A if that's appropriate for you all.
The advocate?
I was wondering, Madam Mayor and Dr. Avegno, if you could tell me whether or not the city is closely watching the protests and, the effect that might have on the disease's spread, particularly the use of tear gas. I understand there was a letter that you guys were sent over the weekend just urging against that as a potential way to spread the disease even more as people cough and people touch their faces. This is wondering if you could address that.
Sure. So first of all, as it relates to following the protests, absolutely. Not only, supporting the protests, but also understanding that we have to make a way for people to do what they rightfully can do, utilize their voice. We have been encouraging and very supportive of our residents who have protested using face coverings, as well as truly trying their hardest to social distance. We have not allowed the protests to prevent us from moving into phase 2 because, one, we know that we are continuing to test at alarming rates, and we will sustain that. And we are really pivoting into wanting to encourage those who have been protesting to do not hesitate to go get a test. We're not setting up a mobile testing site just for protesters, not singling anyone out, but we do want to encourage them that the testing is available to them as well. If you're sick, don't go protest. If you're sick, we want you to stay at home because we do not want someone else to get sick. As it relates to, you mentioned the use of tear gas as a deterrent. As you know, that has been a part of the New Orleans Police Department's policy. However, and I am always willing to review policy and divert, meaning come up with better solutions to address protests that unfortunately cross the line, where there are disturbances that are by choice. And so making sure that we can protect everybody. You know, protect our protesters, protect our people, and also protect our police officers as well. So with that, we will review. But right now that we know that it is a part of policy, and it is never our intentions to really want to have to use any level of force at all. But under my leadership, even as I understand it, engaging the force, our board, our investigative team was deployed during this pandemic in terms of the unrest that we've experienced, but it hasn't been deployed in so long. So this is just a real opportunity, a real opportunity, especially when we know the climate of our country and where we are and where we still have to go. That we will review policies internally and of course with the public, engaging them every step of the way, educating them on what those policies are and what the force looks like, and at the same time, open to any solutions and suggestions that will get us to where we need to be. And that is protecting both the public in regards to protesting as well as law enforcement.
Dr. Wagner wanted to say anything specific. And also, if you could just speak to, we've gotten a lot of questions from readers about whether it will be all protests that will be allowed or just for this specific issue. And I was wondering if you could speak to whether there's going to be any language around protests in particular in the proclamation on Friday, or if it's going to be just for this issue.
Right, clearly, we did see protesting happening as a push to reopen the economy. Right? That was protests happening as well. But as we think about the protests that are happening now, we embrace it as a public health issue, meaning that people are protesting because racism, poverty, discrimination, oppression, that is a direct threat to everyone's public health. So in that regard, we deem that it is essential. So we will support that. But all we're doing at the same time is that we're encouraging and asking our protesters to do it in a way, that is absolutely peaceful so that everyone can truly be safe. Dr. Vegno, I know you had a lot to say about this, so.
I would just echo that, we've talked a lot about essential activities and non-essential activities in the pandemic. And as the mayor mentioned, there were protests that happened several weeks ago, protesting lockdowns in many cities around the country that were, largely peaceful as well. There were public health concerns about large gatherings then. We have public health concerns about large gatherings now. One's ability to exercise your constitutional right to peacefully voice, to use free speech, I think would certainly fall under the more essential category, even as we have public health concerns. We are encouraging people to do it in as safely as possible. As the mayor alluded to, systemic racism kills people in large numbers in our city as well as across the country. That to me is worth speaking out about. And again, we just encourage everyone to do it peacefully and safely.
This is for the mayor. Madam Mayor, can you talk about expectations with Bourbon Street bars reopening, the challenges that may come with that?
Oh, Lord.
Will there be any additional levels of enforcement?
Oh, I'm worried. I am worried. However, This is why when Dr. Vegno was talking specifically about our bars and urging them to follow proper guidelines and social distancing. This is something that we will be monitoring. We're asking the public, employees even, because let me tell you, they utilize 311. And it's all anonymous. We don't ask for anything. We just take the information and we do follow up. So 311 you can do by call, by text. That is a direct link to the administration for code enforcement. So we are allowing the freedom to open up, meaning our businesses, our bars, to open up at 25%. And while we're doing that, we're also asking them to follow the guidelines. If they do not, then we will have to act swiftly in regards to closure. But that is through a process initiated by code enforcement. It does worry me, it does. I have my team, and you will see as weeks progress, just some of these innovative and creative ways that will allow bars, even on Bourbon Street, to follow the guidelines, be able to open up, their doors, but also creating a space, meaning the city, for people to sit, much like at a restaurant and the like. This is very much a work in progress. I received my first batch of ideas and creativity and schematics on Friday. And we're working towards that. But just trying to be as creative as possible, again, to allow businesses to operate in a reduced fashion, but where that economy can run.
Jambalaya?
This is for you, Mayor. The soccer is part of the Latino culture.
Yes.
Before COVID-19, many leagues play every weekend in City Park. The question is, in phase 2, the leagues are allowed to reorganize and come back to play?
Well, in terms of soccer, and Doc,
Yes.
you want to talk about contact sports versus non-contact, and we do understand that not only is soccer, near and dear to our Latino community, it is something that activates our entire city, and particularly even our young people, and so it's something that we definitely want to get back sooner rather than later. But Doc, speak about that contact parents have.
No, and I want to make the distinction, I'm sorry, I don't have the state guidance in front of me, but the state fire marshal does have guidance on outdoor sports. There are some that are clearly not allowed, like football and basketball. Those are considered full contact sports, as you can imagine. There are some that are clearly allowed, running, tennis, golf. I have to say I'm not sure where soccer falls into that category. Something like baseball and softball is a limited contact sport that is being modified. So I would encourage y'all to go to the guidance and see. I don't know right now, but I'll find out.
Okay, and we'll know by Friday, for sure, before Saturday.
Thank you.
WWL?
Yes, ma'am. We were wondering if you encountered any major issues or hurdles regarding compliance during phase 1.
Well, as it relates to phase 1, we had a total of about 144 businesses that we did have to respond to, meaning through code enforcement. And we had over, I believe, 3 that we had to shut down. And actually more than that, because there was a store. There was a couple of bars that served food, but then also a store that wasn't acting appropriately. But those were our top, I think, concerns in terms of having to shut down. But the majority, I would have to say, fell into compliance once they saw and understood that the city is taking enforcement very seriously. And so I'm hopeful that people will just follow rules. But we will be out there, we will be activated, because it's all about public health, public safety. And also, quite frankly, this is not something that I want to turn away from. Meaning, once we get even back to what we're used to doing, I would love to see our city remain very consistent in the level of enforcement throughout our city, keeping it clean, keeping it healthy, keeping it viable, keeping it safe for everyone.
WDSU.
Yes, Mayor, just going back to the protest, I just wanted to know your reaction to the NLPD officer shooting rubber bullets at protesters on CCC without the order from their commander.
Sure, so after the investigation and the findings were evident, we did learn that officers did utilize, and I don't know how many, did utilize rubber bullets without giving the command. That is not protocol, it is a violation, and we will address that swiftly. Accountability is number one, and I know that as I've been your mayor now for 2 years and having put forth Superintendent Ferguson in his role for over a year now, we're consistent in our actions and holding, the men and women of the New Orleans Police Department accountable, just like we're holding ourselves accountable. So, swift action, absolutely. And that's what will make a healthy department, and accountability just breeds accountability. And that means a healthy organization. And so that's what we continue to strive for. But as I look at protests around the country and even the world, I still stand on, very proud of how our officers have handled themselves, handled our protesters, being very empathetic and compassionate and working together. But it's not something that I ever want to see again. But again, it comes with effective training and accountability. And it's something that this department does very well. And we are not turning back, we're moving ahead. So thank you.
WGNO.
In regards to weddings that we had mentioned before, you had mentioned that they would have to have an officer per 50.
A crowd control.
Control?
Yes.
And who does that?
Well, it would be the individuals who are getting married, and also aligned with the establishments that they are working with to hold their wedding. Based on these phase 2 guidelines, it doesn't seem, it's kind of like a wedding with no music other than the DJ, no dancing, social distancing and the like. But in the event, our couples want to move forward, they can do so with a crowd of 100 with all of the guidelines having to be adhered to, which includes crowd control officers.
Telemundo.
Yes, about the Hard Rock Hotel, this continues, the demolition, the Hard Rock Hotel.
Oh, Hard
Yeah.
Rock Hotel, I'm sorry.
Yeah, I'm
Here,
sorry.
I'm sorry. Okay, so Hard Rock Hotel, you're just asking me for a general update on that?
Yes.
We did, because of Tropical Storm Cristobal, we had to suspend activity there. And we moved forward, meaning they, because the city isn't over it, the ownership and the contractors are moving forward as planned. So right now, all is well. Every day, it's a different day, which is why, quite frankly, the city of New Orleans allowed for a permit, but with provisions, conditional permit, so that we can watch every step of the way.
Thank you.
Right now, we're okay.
Okay, thank you.
Any other questions?
Yeah, I do.
Yeah.
If you don't mind.
Last
As-
question.
As far as you know, have you had any reports of the hotel during the storm in the last 2 days? Has anything moved, any debris come off, or have there been any situations?
Okay, not that we are aware of, that there were any shifts in the facility at all. We do have a review actually happening today, I believe, with our independent engineers, but there were no reports at all with anything shifting on the site.
Thank you very much.
Okay, well, thank you all so much. We'll continue to keep you abreast of phase 2 and anything that you need coming from the city of New Orleans. So we appreciate you and thank you again.
Thank you.